Awesome. Perfect. All right, guys. Hi, everyone. Thank you so much for joining me and for giving me the opportunity to speak with you today. So we're going to jump right into the presentation. And if you have any questions, like Maricela said, please drop it in the chat. I'd be happy to answer any questions that I can. So I'm going to start sharing my screen here and present. Okay. Oops. All right. Can everyone see my screen?
Yes.
Okay, perfect. All right, so your vote matters. So just a little bit about me and kind of who I am and why I'm here to give you guys the talk. My name is Priya. I'm a community advocate. I live out in Redlands, California. I always say California because my parents are from the Midwest. So anytime people are like, where are you from? I'm like, I'm in California. And I am a medical school student at CUSM, which is California University of Science and Medicine. I'm a first year. So a little bit about me. So I was born in New Delhi, India, which is like, I think I calculated 7,000 miles away from Redlands. And when I was just a little child, my parents had the American dream. They wanted to move to the country of opportunity. So we found ourselves greeted by Lady Liberty in New York City and moved out there when I was just a baby and had, a great time in New York. It was the big melting pot. And there were a lot of difficulties when my parents first started with like jobs and things like that. And my sister was born. And because we were immigrants, we weren't allowed to use a lot of the safety net services like Medi-Cal or like food stamps or you name it. So we were a struggling family back then, trying to live in the Big Apple. But once my parents kind of got on their feet and right after 9/11, which had kind of created this like racial, cultural, crazy tension, we moved out to rural Michigan, which was a massive change. Like we went from, seeing skyscrapers on a daily basis. Actually, when I was younger, my dad used to actually take me on the weekends all the way up to the Twin Towers. So we went from that lifestyle, riding trains, to this like farm life in the middle of Michigan. So literally, when people ask you about Michigan geography, they always hold up their hands like the mitten. And we were right in the middle, so central Michigan. So I spent my younger years there, went to the University of Michigan, graduated, and then I met the love of my life. And then I moved to Minnesota, where after receiving my biology degree, I used that biology degree to do a lot of research in HIV and AIDS. So I was working on finding new medications for HIV and AIDS patients in sub-Saharan Africa. The problem is, though, as I was researching this drug, which showed a lot of promise, I was really concerned about other things because as a struggling, full-time researcher, I was like trying to find healthcare and other things, and it was very difficult for me to get medication. I remember like ibuprofen, which was, something that we always had in our house. Like I would go to the store and realize it's, 10, 15 bucks, and that was a struggle. And so I started thinking about the drugs that I was researching, which are very rare, and questioning, the lifestyles of a sub-Saharan African village mother and how she would have access to those drugs. Like, how would she get to the middle centers? How would she take those drugs? Does she have enough food? So those were the kind of questions I started asking. And that's what opened my like world, and it just kind of opened these new doors to the field of public health. So after Minnesota, I found myself at Columbia University, back in New York, doing my master's of public health. And after that, I got my degree in health policy analysis, and then I ended up in California, where I was a health policy analyst at Loma Linda University Health right before I started medical school this year. So that's a little bit about me and my crazy journey. Let's go back. So I just wanted to give you guys like a little lens into my life when I was growing up. So this is my yearbook, and these are my classmates from 6th grade to 12th grade. And as you can see, there is little to no diversity, except for maybe like a couple of my friends who came along the way later on, but I was there from the beginning. And so it was a very, very non-diverse neighborhood that I grew up in, very conservative. And I was the only person who was non-Catholic, in a Catholic school. I was the only person who had black hair for the longest time, the only person who had the olive colored skin. So it was a struggle. And in rural Michigan, we didn't have too much to look forward to in terms of role models. So for me, all of our role models were pretty much people who didn't look like me. But I had a good time. I tried to, as it may be frustrating at times, I tried to still educate and teach people about my culture, and just trying to like work with the situation I had because there was no other option. And we all became really great friends and grew up together, and it was great. So all that kind of like changed in 2008. So this is me. This is literally the very first, this is a picture of me seeing Obama for the very first time. I don't know if anybody has pictures like that, but that is me when we saw Obama come onto stage. And that changed the game for me because growing up with a family that was in healthcare, I saw this president who finally looked different, who finally had a message about making sure that there was equitable opportunity for people. And that to me just stood out like in a way that it just dragged me into politics in a way that I never could have imagined. So that year I was phone banking, like 13-year-old me, like phone banking people for the very first time saying, hi, did you vote for Barack Obama? And so many people were like, now, do you know where we are? Like, this is rural Michigan. But it was a great experience and it was a good way to be involved. And it was the very first time that I actually communicated with people in my community outside of that little bubble of just school. So I got involved in that. And then school started, then I graduated from high school, school started, and I got all into biology. So went to Michigan, got my degree in the biological sciences. And then, like I said, I went and did research at the University of Minnesota. So everything was very much research focused, science focused, trying to get into med school, pre-med route, all about health. So fast forward to after Minnesota, I ended up at Columbia University where I was getting my master's in public health. And that is kind of that was kind of my way back into politics, and social problems. And I realized that it doesn't have to be in isolation. I realized that healthcare is a political and is a policy issue. So this is a picture with me and my professor, Chelsea Clinton. And at that time, this was 2016, so her mom was running for president. And it was a game changer because we had just spent like a whole year talking about the Affordable Care Act. And in our minds, this Affordable Care Act was going to last. And we were trying to first dissect the law, understand it, and then understand how to make it better, to improve it so that more people would have access to healthcare. And of course, 2016 came and went and things didn't go as planned. And then, a couple years later, the individual mandate, which requires everyone to have health insurance, was knocked down by the Supreme Court. And so we're at this standstill now where we had the ACA, but it has crumbled to pieces. And, a lot of people are at risk of not having health care. So those are the issues that really got to me. And going back from rural Michigan to New York, I started to see the similarities in the populations. So I noticed that even out in rural Michigan, it took us 1.5 hours to get to the hospital. Farmers could not afford health care. They were struggling. It was the same issue in upper New York, where we had the population of Latinos and Hispanics. Like, they were struggling with the same issues that people in rural Michigan were struggling with. And the answer lies in ensuring that everybody has access to healthcare, access to good food, access to good education. So those are all policy issues that stemmed back to every facet of our life. So I really got involved in, I finished my education, but really started to get involved in how I could use policy making as a tool to move forward and start paving our way towards equality and justice when we talk about education and healthcare. So after Columbia, like I said, I moved on to Loma Linda University, where I was a health policy analyst. And I'd be happy to share with you guys the link. I was doing a lot of research on San Bernardino County to understand what the various health issues were. And as I was doing this is really the time where I was able to form my values. So, as little kids, like, we'll look at a homeless person, we understand they shouldn't be homeless. as we're going through college and, trying to figure out who we are, we understand like, okay, this is kind of the job I want to do. I want to have a kid. I want to have a family. This is kind of what I want to do. But it's really in that time that we really form our values to understand who we are and how we're going to live our lives. And for me, Columbia was that time where I started to understand what are things that are important to me. And I realized that a lot of these things were not just about me, they were about my community and everyone around me, because that really influenced how I felt and my opportunities, as well as the opportunities of people around me. So my values got set at that point. And I realized that there were some things that were just so important to me that I want to commit my life, the rest of it, to fighting for these issues. And so access to affordable healthcare for every single person. We are one of the only developed nations without basic access to affordable healthcare, which is just a travesty considering how much money we spend on healthcare per person. Economic justice. Again, we're at this crux where there is a major divide between the people who make a lot of money and then the middle class families. Environmental justice. San Bernardino County is like the best example. I have asthma. I can't even go outside without feeling that. And as I was doing a lot of research at Loma Linda, I started to realize that the justice component is so important, because we can talk about cleaning the environment. Like we can talk about companies, not polluting or not, taxing our plastic bags, people driving less. But there is a disproportionate, playing field when it comes to where those companies are built, whose ground they're built on, and where they're allowed to pollute. And so justice is a very important component of that, because what we see is that a lot of the pollution tends to happen in the disadvantaged areas that can't fight for themselves. So environmental justice was very, very important to me. Equitable opportunity for quality education and jobs. You always hear that, you can teach a man to fish, you can give a man a fish for a day, but if you teach him to fish, he has fish for life. But you can't do that if the man can't afford a fishing pole. You can't do that if the man doesn't have somebody who teaches him how to fish. You have to have those components, and that comes through quality education and jobs. And then finally, criminal justice reform. It's mind-boggling to me how, again, our nation has private prisons, and the way that we're set up, it is a system that's not fair and does not give people the opportunity to reform. So these were my core values that I really formed. And once I had these core values, I was trying to think, okay, I know what I want. I know what my community needs. I've had these conversations with people. Now, how do I put that to action? So, one more thing actually that I wanted to say, because this is how I form my values. I always thought that America, we were at a crux between the right side and the left side. I thought that was politics. But the two Americas are not right side and left side. The two Americas are the figure down here. It's the economic injustice. Those are the two Americas we live in. We have a sum of people who have all the power, all the wealth, and the ability to make any kind of change they want to. And then we have our middle class families that are fighting for, again, access to education, access to healthcare, access to good food. So this right here is how I look at politics. And this is how I look at policy making when we're trying to decide how do we move forward and not the red and blue issue. And I think that's going to change too as we move forward. So I took all this and I started to think, what can I do? I had just gotten my citizenship. And I read this book called Government 101. It's like a very tiny book. And my political science boyfriend, who's now a lawyer, laughs at me because he's like, you're reading, it's like a political science for dummies kind of book. But I read it and I was like, what? People can run for office at the local level? I don't have to I thought I could never be president because I was born abroad. But I didn't realize that I could run for other things locally. And what I realized was there was a lot of power to make the kind of decisions I wanted to make at a local level. And what were the qualifications? This is it. 18 years old, you live in the district, and you get you get 20 people to sign your paper, and you put it in by the deadline. So that's what I did. I went and I put my name in for the Redland City Council. I walked around my neighborhood talked to 30, 35 people, gathered 30 signatures within a week, and deposited that to the city hall, and I was officially a candidate. And so what was the power of the local government that really attracted me? So at the local level, city, town, and county council members and our commissioners are legislators. So this depends it depends on where you are and how your county was formed, how your city was formed, and what was in the original forming documents. That'll really determine, like, is it, council members, is it city commissioners, but it's pretty much the same thing. You've got a local council level. And our political system, it's not a democracy, right? We don't go in and make decisions on every single little item on the budget line. What we do every 2 to 4 years is we elect legislators on our behalf to make those decisions and enact the laws for us. So local government is responsible for a ton of things. So functioning and delivery of a complete range of services, right? Our communities, our parks, our gardens, our roads, our streets, our bridges, libraries. And then they're also responsible for maintaining services. So who comes to pick up our garbage, our water services, how we register our pets, all of those things. And so they are the local lawmakers, and they do everything that's related to building, planning, and the health and well-being of each individual. So when you think about it, yes, we've got our congresspeople. Yes, we've got the president. The president does not make the decisions that affect our local day-to-day lives. It's just the truth of the matter. And the local government also gets to make a lot of the decisions when it comes to public health. So all of those things combined made me realize that there is so much power in local government, but that unleashed another beast of its own. Because there is so much power, there are a lot of people who want to get those positions. So let me move on here. Oops. Okay. So the other thing about this, so coming from the public health perspective, there is a saying: the greatest determinant of how long you will live comes down to one number. So it's not the money that you make. It's not your age. It's your zip code. Your zip code single-handedly is the biggest determinant of how long you're going to live your life. Imagine that. And that is a huge, it's a study that's been done that shows that zip code takes over a lot of other things. So you could, grow up in a wealthy family, but if you're living in a low-income neighborhood, your lifespan would be dictated by that. So it's your zip code. And again, where does the power of how your zip code affects you comes from? It's the local government. So, so I'm going to talk, I'll get to the run in just a second, but I wanted to talk about the public health aspect of local government. So public health, so when we talk about a person's zip code, right, I said there are a lot of different factors that influence that. So these are called the social determinants of health. This is how your zip code determines your lifespan. So there are a lot of things that go into the social determinants of health, but the bulk of it is economic stability, your neighborhood and physical environment, your education, your food, community and social context, and the healthcare system around you. So economic stability, this is not just the individual economic stability, but the stability of your community. So employment, income, expenses, debt, medical bills, and support can dictate how long a person could live from a condition like diabetes or cardiovascular disease. Your housing determines that. If you have, so for me, when I was growing up in New York, I had high levels of lead in my blood. And that was because we were living in dilapidated apartment complexes. I had high levels of, I had really chronic asthma growing up. And that was because I grew up in housing that was susceptible to bad air conditions, to mold. And so those things in the beginning, the prime of my life, could have a big bearing on how long my lifespan is and how long the lifespan for all the children around me were. And then if you add into that all of these other things like educational opportunities, So if you can't have good educational opportunities, you're not going to be able to climb that ladder. So people say you got to study hard, but how are you supposed to study hard when your building is breaking down, when you don't have access to books, when you go home and your parents are struggling and you have to come up with a job to be able to pay for that? So you can't focus on your education. So as you can see, when you take the person, it's everything around them that really dictates their health, not just their health choices. So when you go to a physician, for instance, and they tell you like you have to eat healthier, you have to quit smoking, we are now learning that physicians need to take all of these other things into account. Do you have access to parks where you can go and walk around? Do you have access to good, healthy food? If not, let's talk about what your options are. And then also, with the healthcare system, that's again another part of it. Do you have? Are you covered by health insurance? And then what kind of health insurance do you have? So those kind of things all are. If you think about a person in the middle, all of these concentric circles around them are really what determine how long they're going to live. And all of these things, economic stability, neighborhood physical environment, education, food, community and social context, healthcare system, they're all really, really very much in control by our local governments that have the power to either make your zip code a great one where you have all these opportunities, or not invest so much in the community and perpetuate a cycle of inability to get out of. So that's kind of the social determinants of health. But if anybody has any questions, like please feel free to ask me and I'd be happy to talk more about those. So all of this got me into saying, you know what, we've got a lot of power in the local government. So in 2018, like I said, I put in my papers and I ran for city council. Having never run an election before and not realizing how competitive it was, I kind of just did the thing that a 25-year-old girl would do, which was knocking on doors and talking to people. And so I spent a good 3 months. Every day I would go to work from 9 to 5. And after 5, I would go and talk to people. I had no list. I didn't know whose place I was walking into, whose door I was knocking on, what their party affiliation was, whether or not they were registered. I didn't know. All I knew is I was going to have this conversation with people and try to understand where they were and what their needs were. And so that was a really great experience. And for somebody who never had experience running for a public office and no volunteers or money or anything like that, I came in second place, which I thought was really, really cool. And that also goes to show you, if you come and talk to people, you build that relationship and trust with them. So I did that in 2018. And so in 2018, and this is now I want to get back to the why your vote matters. In 2018, my friend ran in the city of San Bernardino. Same thing. She was very young. She knew she had these ideas of, the principles of expanding healthcare, education, and access, equal opportunity for people. And so she ran a very small group of people. She was running against, I believe he was an incumbent. If you guys look at this, this is insane. 3,709 votes is what he won by, and she had 3,701 votes. 8 votes determined that election. 8 votes determined who was going to sit at the hall of power to be able to make the decisions that would affect your day-to-day life. 8 votes. That is 8 more people whose doors we could have knocked on, but when you've got a whole bunch of, when you've got a short amount of time, it's very hard. So 4 years that we have this person and not her. So when you ask, why does my vote matter? A lot of us think like, what does it matter which president I'm voting for? We live in California. Probably doesn't. You're right. But what does matter, like your president is not making decisions on your roads. It's your city council members. The president is not making decisions on your education or making sure that your kids get to school safely. That is your city council members. Those are the people that are winning by 8 votes. So what we did is we realized that we could do this, that local government, people want to be there. So we have to make sure that as young people, we're getting good people elected to local office. So after 2018, we gathered around, we got our candidates together, and we knocked on every single door. We didn't take any big money because those were our values. And this year in 2020, San Bernardino City Council, we won by just 18 votes. So again, your vote is so, so important. You could be one of those votes in your city that change the landscape for years and years to come. So that's why voting is so important, because again, it's not about the president, it's not about your congresspeople, it's about the local offices. And there's more than just the city council. There are school boards, there are water boards, there are county supervisors. All of these positions have massive amounts of your taxpayer dollars, and they get to make the decisions about where those go. So on your ballot, when you vote, you've got to look out for school board, water board, county supervisor. That's where those 8 votes, those 10 votes make a difference. And I believe that when I was voting, I think it was in 2018, there's an area around here where literally there was like a water board where there were only 2 votes, and those 2 votes determined who the winner was. So it's insane, but this is where the power of the people lies. It's in these local positions, and the system was designed to be this way so that we had more power over how we were going to live our lives. So moving forward, so I've talked to you about local elections, but I do want to talk to you a little bit about healthcare, and I'm just trying to keep track of the time here. Marisela, can you give me a check on the time?
It is 12:27.
Okay, perfect. All right. So 2020 election healthcare. So like I talked to you about when I was getting my master's, the ACA, the Affordable Care Act, also colloquially named as Obamacare, was in play. And we cannot ignore the big elephant in the room, which is COVID-19. So before COVID-19, we had I don't want to say liberty, but at least we did have a little bit of flexibility in how we were thinking about healthcare, but it was in the back of our minds. COVID-19 hit, and every single person in the world was affected. And we realized that all those things we were pushing off, this idea of having universal healthcare someday, where we could walk into a hospital and just get seen without having to figure out how to pay for it, have access to preventative services, to make sure that we're not coming in just when we have an emergency situation, were no longer things that we would dream about. Those are things that needed to happen now, because COVID-19 was the big impetus behind this devastating condition. So if we look, and this goes back to our healthcare system, the way that we're dealing with COVID-19, if you look at how other nations are doing, the United States, it's not doing great. I mean, and we're if you look at the line at the very end, we're back to surging. You see that in many other countries as well, but it's a little bit more moderated, and they're doing a little bit better of a job. But when you've got no standard of healthcare, you're going to start off with a lot of sick people who have nowhere to go, and they're going to get other people sick. So the United States is already suffering the effects, and I don't want to say we're doing the worst, but it's not great. The outcome is not great. No matter what you hear, it's not getting better at this moment. So that means that healthcare is now the center focus. I want to also preface, I should have started the talk with this, but I'm not here representing anybody. I'm not here representing my school. I'm just here as a community advocate talking to you guys. And also everything that I'm saying to you is just literally, it's based on research and facts. And so I'm not taking any political viewpoint on anything, just here to give you guys information and to remind you why it's important to vote. But I did want to bring attention to this JAMA article. So the Journal of the American Medical Association is the most prestigious scientific journal in the country. For people who are for medical students like me and pre-med students, like JAMA is our go-to. We read about the current issues, research ideas, you name it, it's all in JAMA. So JAMA, for the very, very first time in the history of the journal, came out and they actually made a political statement. And this is very unprecedented, but this is why I'm saying that the United States isn't doing so well, is because scientists and researchers are looking at this epidemic, the pandemic. They're comparing the United States to other countries. And according to JAMA, our administration has responded so poorly to this coronavirus pandemic that it's taken a crisis and turned it into a tragedy. These are the words of the New England Journal of Medicine. So again, it's nonpartisan, it's a medical research journal, but it's showing us that we are not in a good situation right now. and we have to do something about this. So I want to now talk about going back to the ACA, because we were hoping that the ACA was going to be our pathway into universal health care. So the ACA did three key things. The ACA is a very, very complex law that was written in such, like, when you, if you ever take like a healthcare law class and you read about the ACA, the complexity of it is just insane. So to boil it down to just three things, it did three things, right? It made affordable health, health insurance affordable and available to more people. So what it did is it provided premium tax credits, and it opened the eligibility for people who could get onto health insurance from between 100% of the federal poverty level and 400%. So before, I believe it was, I don't have the exact number, but it was a lot smaller than that, which meant that lower income people had a certain income level. And then the ACA expanded that to allow more people to be eligible for health insurance through the government. It expanded the Medicaid program to cover all adults with incomes below 138% of the federal poverty level. So this is huge. When we talk about Medi-Cal or Medicaid, before the ACA, there were people who just didn't have health insurance, and that's it. So there was no going to the hospital. You cut your toe, you were afraid of how much you were going to pay. Because Medicaid, the insurance that was for the low-income individuals, went to people who were like basically making nothing. So when you expanded the Medicaid program, it started to cover the working class people, especially those who were paying money into education and then making minimum wage, because our wage hasn't increased. So this expanded Medicaid and allowed a lot more low-income people to be covered by health insurance. And then finally, it had all these programs to support innovative medical care delivery methods. So, innovating how we're talking about care, from telehealth to various kinds of technologies. So ACA was it was a jam-packed deal, and in essence, increased the coverage. So under the ACA, 20 million more people were covered. And that is a huge amount. And if you look at just how many more, it obviously impacted impacted race a lot. So this graph right here is showing the uninsurance rate. So uninsurance went down, which means insurance went up. So again, if you look here, this is, when you talk about race and ethnicity, which is also a social determinant of health because of the systemic problems in our nation, affordable healthcare actually helped to decrease that gap, that inequity. Same thing, if you look at the education, like people who had no high school diplomas were very much uninsured. And then after the ACA, that uninsurance rate dropped, a lot more people were covered. And so across the board, the ACA was covering people. And we had a lot, and if you look at actually the research articles, you can see the effects of the ACA. It improved health outcomes overall. So what it showed is that when people have healthcare coverage, their mental health is better, their physical health is better, and they just fare better. Their life expectancy goes up. So now we're looking at 2020. We're talking about November. And I'm not going to go through these slides. They're on the Kaiser Family Foundation. But what they do is they break it down for us. Let me see if I can reduce this bar here so I can see it. Okay, so what they do is they break it down for us in the issues, and they compare our two candidates. And again, it's not a partisan thing. It's just looking at the record versus the proposals. So what the ACA would look like. Under a Trump administration, we've already gotten rid of individual mandates, and they're promoting the shorter term health plans that have lower premiums, but they also won't cover something like pre-existing conditions. So again, before the ACA, if you had a pre-existing condition like diabetes or heart disease, you had a very tough time getting medical insurance, or it would be very, very expensive because companies did not want to take in people who were sick because they knew that healthcare insurance companies knew that those people had a higher risk of having to see the doctor continuously. So that's called a pre-existing condition. And that's why they didn't, you were more likely to have a higher rate of insurance. And so that's kind of what the ACA had done, is got rid of any kind of discrimination against people with pre-existing conditions. Now, with the new ACA, with 2020, if we have another Trump administration, we might be looking at the complete repeal of ACA, which means we might lose Medicaid expansion. We'd be looking at short-term health insurance plans with no guarantee of coverage of pre-existing conditions. And so there are a lot of different, basically this would tear down the ACA. And I believe the proposal from Biden's side is to bolster the ACA as well as create a new public option. So if anybody has any questions on that, I'd be happy to talk to you about that at some other time. And then let's look here. So the next thing is, again, Medicaid, right? Like I said, the Medicaid was part of the ACA build-in. Under Biden's proposal, we would have expansion of Medicaid. And under the Trump administration, we would have the rollback of Medicaid. And then looking at Medicare, so the difference between Medicare and Medicaid, I always think of Medicare as caring for the elderly, and Medicaid is aiding, low income populations. So Medicare would be for the elderly. And so there are even, when we think about it, all of us will be on Medicare at some point or the other once we turn 65. And if we don't, take care of our money properly and we don't come up with a plan, we don't have long-term insurance plans in this country. So all of those things could be affected, especially not just our health now, but down the road, depending on how this election goes. So I hope that I've been able to get across, why your vote matters. Again, as much as we talk about the presidential elections, it's really all about our local level. It's about our state level. And then, of course, there are votes at the federal level. But the biggest thing is, this is the craziest thing to me, young people in San Bernardino County and Riverside County have the power to determine almost every single election. So this is the current, I believe this is just from yesterday. Look at how many ballots went out with our age group. We had the most ballots go out to our age group, and to the 18 to 34, so my age group, and then also the 35 to 49. But look at how many of 18 to 34-year-olds turned in their ballot compared to people who are 65 and older. This is why we need to vote, because we could determine every single election at the local level. And then finally, just wanted to say, and then California allows same-day voting. So let's say you've missed your registration, you can show up, put your mask on, show up with your ID, and you can vote on the same day. People in our community have fought so hard to make sure that we all have that right to do that. And then finally, last but not least, voting is difficult and it's overwhelming. It's not an easy thing to do. That's why it's a right. Like when I voted for myself, I got overwhelmed looking at all of the different, the courts, judges, the school boards. At some point I was like, I should just guess. I don't know what to do. And so it is a very hard thing. It's a very stressful process. And so what I would recommend in that case is look to the local organizations whose values match your values, because they often do that work for you and they provide endorsements of candidates. And then also, most importantly, recommendations and propositions. So there are a lot of important propositions on your ballot this year. Again, those propositions will be determined by your votes. They might be 10, 15 votes. So you've got to carefully look at those propositions and vote with your conscience. So that is the end of my presentation, but I'm happy to take any questions. And I hope that was engaging for you guys. I'm gonna charge my laptop here.
That really was, Priya. Thank you so much for taking the time to educate us. I know I learned a new few things today, and I know we have participants and joined us a little bit after we logged in today. So I've been including the opportunity to ask any questions in the chat. But Priya, I think you did such an excellent job that we don't have any questions. So at this point, we will also be opening up to any students who have any questions. Feel free to just chime in and unmute yourselves. And by the way, I'm Marisela. I don't think I properly introduced myself to all of you. I work in the student life department. And the reason why we're having these Eagle Talk series is because we're gearing up for a local election. And as is mentioned, we've had discussions in several different topics. And today's main discussion was regarding healthcare and the issues that will affect our community in this upcoming election. So if we have any questions, feel free to unmute yourselves. Any thoughts, questions, concerns?
I can go.
Yeah, go ahead, Ariana.
Hi, I'm Mariana, and I'm part of the student government and also a first experience mentor. And And I agree with you that on the last note that you said that it was stressful and, all you had to get knowledgeable and read a lot. Me, in my experience, I'm from Puerto Rico, so I don't really had the right to vote on the U.S. elections, even though I'm a U.S. citizen. And this is my first year that I can officially vote. And I can tell you it was hard to get the propositions. Who is the vice president? Something so simple like everybody knows who's the vice president and like president, but I personally didn't know what were the roles or what the importance was, and also from the community on Menifee. I didn't know the same how many people are involved in my district and my community. So thank you so much for the information. I took a lot of notes. So thank you again for your time.
Of course. And what you just said is so important. I mean, Puerto Rico is part of us. And the fact that it took so long for you to be able to vote, those are the kind of things we're fighting for, right? Like when we vote and we determine who our legislators are, those are things that we can, like for our generation, maybe we can't change that, but for the incoming generations, we can. So I want to thank you. I want to commend you for voting. Congratulations on getting your citizenship. And yeah, like I had no idea what local government was. Like I said, it took me until I turned 21 to finally realize, what are the different roles. I had no idea what the difference between the legislative, judicial, and executive branch were. Those were things we learned in, high school, and we were just trying to get over them so we can go dissect frogs. So I totally understand. And I think eventually, if we just keep reaching out to our fellow peers like this and say, hey, like, it's never too late, and now is the time to help make those decisions and help mold our society into what we want to be. This is the time now. And so reaching across and really grabbing each other's hands saying, let's do this together. So thank you so much for sharing, and I'm so happy for you.
Yes, thank you. Moving right along, Joseph, I believe you had a question. And if you could
Yeah,
introduce yourselves to the group, Joseph, that would be awesome. Uh-oh. Joseph, you're frozen on our end. I'm not sure if you could hear us. Okay, well, we'll give Joseph a second. I wanted to point out, Priya, that Jose, he's also my colleague here at MSJC. He wrote in the comment section such good information. Thank you, Priya. So we wanted to let that be known. Any other questions, comments, concerns from the group that you have for Priya? And she actually has an exam right after this. So more of a reason why we're so thankful that you took time
Good
to.
luck. Good luck.
And speaking of that, Priya, can you tell us a little bit about what you're studying right now in case any of the students can relate to that?
Absolutely. So like I said, I was in the biological sciences field, and I'm currently a first year medical school student. So 3.5 more years to go until I can start residency and get my MD. But that's what I'm studying is medicine. And specifically, I chose this university here because of its commitment to our San Bernardino County population. So a couple of things we're doing, like we learn medical Spanish to be able to speak to our community, because I'm not very good at Spanish. So we're learning how to talk to our community and be that resource for our community. So if anybody has questions, like my road to medicine was so tumultuous, like, going from biological sciences to taking 2 years off, to then getting my master's of public health, to then working for 2 years, to then finally starting medical school. I had a very, different route than most people who do undergrad and they go to medical school students. So I'm considered a non-traditional student. So if anybody has any questions, you need mentorship, I highly recommend looking towards my university, CUSM, as a good, it's a feeding school for people here in our county, or in our 2 counties. So if you ever have any questions and you want to come check out my school, right now we're all virtual, but I'm happy to be that mentor for you guys, and send me your questions or anything like that. I'd be happy to share that as well.
Thank you very much, Priya. And our MSJ students can relate. We're all virtual, and we will continue to be. It's looking like until the spring semester. There's still a great uncertainty, so our students can definitely relate to that. Do we have any additional thoughts from the group before we wrap up the conversation? I believe Joseph is joining back. He may have a question.
I have
Hey, Joseph, you're back with us.
so yes, I'm sorry about that. It cut out.
No problem.
It's all good. We're happy to take your question.
Perfect. So it was a little more of a comment than a question. Just wanted to make sure, like, well, I had a teacher back at MSJC who loved to say, democracy is not a spectator sport. It is a team sport. Everybody's got to play their team. And another great thing is don't take somebody else's opinion. You need to, do your own research, make sure you build your own opinion because, I've got family and friends who think one way and I'll go do some research and I'll be like, what they said wasn't accurate. What they said isn't truthful because a lot of places like news and media, different places will twist the words to make it sound positive, but they're really being truthful saying it's a negative thing. But the way they word it makes it sound positive. So just, make sure you do your research and you put in the time to make sure you know what you're voting for and who you're voting for because as we're saying, this determines the next, for at least presidential level, the next 4 years of our lives, local level, the next 5 to 10 years of our lives. You want to make sure you know exactly what you're voting for to make sure you do what you think is right for you.
Yes, exactly. Thank you so much. Priya, did you have some thoughts regarding that comment?
No, I completely agree. It is absolutely. I think that like I said, that's why voting is so hard, right? Because we've got so many people, and people take advantage of that. People know that when you look at things like local board, local councils, school board, that you're probably not going to pay attention, right? That you're kind of focused on those bigger races. So they take advantage of that. And so you see the billboard, you're like, hey, I've seen that name before. I think I'm just going to vote that way. So you're right. You've got to vote on the issues. You need to research the candidates. And oftentimes, if you don't have the time, at least just read their blurb and try and understand if that's something that stands out to you. I think in politics, gut instinct is the most important thing when you're voting. Aside from all the research, you want to go with somebody who you can kind of read their thing and say, yep, I think their values align. So at the end of the day, yes, they're going to make tough decisions. No, they're not always going to make the decisions that I want, but I know that their values align with the community values.
Yes, and that's another great thing. Make sure, vote for the ideas, not the person. Because it's not, whenever you vote, it's not just that person, it's their whole administration. So, there's been times where I've had friends and family who have run for local government, but I didn't agree with their standings and what they wanted to do. So, I unfortunately, I voted for the other person because as much as I love them to death, they're friends and family and they'll stay friends and family. But, I want a local leader who's going to work for for the community, for the people.
Very, very well said. So we are reaching the end of our event, and I'd like to thank each and every one of you for coming out today. And like we mentioned, elections are less than a week away. If you haven't yet voted, please be sure you have a plan and carve some time out to do so, and take time again to do your research to make sure that your voice matters in this upcoming election. So Priya, any final thoughts before we conclude today's presentation?
I just want to say thank you to you guys. Like, I know you're students. I know that you've got a lot on your plates. I'm a student as well. And so it is hard, like balancing everything. But I just want to thank you guys for taking the time out of your lunch break to come listen to me. And yes, please, please, please go vote. Please encourage your friends and family members to vote. And again, I'm a resource here if anybody needs me.
Thank you all so much. And we will be continuing these Eagle Talk series. So please go ahead and keep an eye out for those. And well, thank you all so much. I have nothing left else to say here. I will see you all in the next Eagle Talk series. And thank you all so much. If you'd like to go ahead and tune in and watch this presentation over again, we'll be sharing it on our YouTube channel at SLDP. So once again, thank you all very much and have a wonderful rest of your day.
Thank you very much.
Thank you. Bye.
Thank you.